on both. Hi, everybody.
Hi.
Welcome to Coolsculpting, which is one of my favorite procedures here. So we are predestined with fat cells when we're a child. Some people have more, some people have less. What I love about Coolsculpting is it's non-invasive. So just think, fat freezing cells, no dicing, no cutting, no injections, happy patients. So typically what I like to tell people is it's not a one size fits all. So when you come in, I do like to see, feel, look and see if you're a great candidate, because not everyone's a great candidate. This is not like come in and have a weight loss system, you know. What's the best way to describe it? Like people come in like, will I lose weight? So our patient here, Erin, she just has this, these areas on her belly, I guess is the best way to describe it. Like tell everyone like, what do you feel about your belly that you just want to like just improve?
So, I mean, I feel like just, you know, there's little fat, you know, especially like whenever clothes that maybe like certain things don't fit as nice. You know, I'm not somebody, I'm active, I'm not somebody who's like super active in the sense that like, you know, it's super stubborn. I could lose some of it, you know, with working out better, but there is some that's just stubborn after kids and just different things. And I just really kind of ultimately want to look better in clothing. I think that's my biggest thing.
And a lot of times I'll tell people that, like if you are someone who's a little bit older and you have looser skin, your clothes will fit better. It's not necessarily going to make your skin look better. You will have some tightening, but this is not a tightening device. So what we want to do is freeze our fat cells. The science term is called cryolipolysis, which is basically just the science term for freezing fat cells. So whenever we marked her, so what we do is we'll mark you when you first come in, and we'll kind of squeeze and determine what's like the best device. The cool thing about Coolsculpting is we can do lots of different areas. We can do submental, we can do your arms, we can do belly, we can do inner thighs. Those are kind of the main spots. One of my favorite spots to do is what's called the bra rolls. And it's literally that little spot. Let me show an Ishla's back. That little spot right beneath your bra that literally everyone hates. And it's really hard to get rid of it through working out. So I popped that little one on there, and it is an amazing adjustment in how your shirts fit, how your bra fits. It's one of my favorites. So today we're going to put it on her and get her going. She is going to have 45 minutes on the machine. You can watch TV, you can play on your phone, you can talk. I've had people do an entire staff meeting on their devices while they're on the Coolsculpting. Yeah. So it's super easy. We give her the Bobby. So once we get it on her, she's going to feel about 7 to 10 minutes of just sort of maybe a little bit of uncomfortableness. Like it's not painful. It just sort of is like, whoa, that feels kind of tight. But she'll still be able to talk. And once you get past that 10 minutes, that cooling effect takes in, and then you're good to go. And then it's just fun. Alrighty. This is what the device looks like. Coolsculpting. Like I said, it is a game changer for someone who doesn't want the downtime, who doesn't want anesthesia. It is one of my favorite procedures to do in general.
Is there any swelling or bruising with this?
You can definitely have swelling afterwards. So I tell people don't do it and expect to go to the beach and look great the next day. Bruising, I have some people bruise, but it's not really that common. So I'm going to put this on, so this is what it's going to look like. And once it gets on, it's going to suck the fat, and you're actually going to be able to see it. Once I have her move her video over, you can actually see the fat on the side. I'll let you all see that. Alrighty.
How many treatments do people need?
2 treatments. 2 treatments, 30 days apart. Okay, ready? Yep, 1, 2, 3. Okay. So she's on. Okay, so she is on. She's good to go.
When will you be able to see results?
So we tell people it's 60 days after your second treatment. So I usually, and some people honestly, once they get going, I had a guy recently who was doing it just purely for those resilient spots because he was entering into a contest, like a weightlifting contest. He had results really quick because he really didn't have a lot of pockets. Erin, I would say do her second treatment in 30 days and she'll be awesome by May. Yeah,
April.
Perfect.
Someone said if you eliminate fat in an area, doesn't that mean that fat will then be transferred to another part of the body?
No, that is totally not true. So basically the areas we're targeting, if she were to like gain a whole bunch of weight, she's most likely not going to gain it in the areas that we're going to treat. It will go elsewhere. So typically once we remove those fat cells from that particular spot, it will not come back there. That's a good question.
Do you know another question I feel like a lot of viewers might have, and I would think of is, say you do this, what happens when you get pregnant?
Yeah. So I've had lots of patients who've gotten pregnant later. Obviously, when you get pregnant, you're going to get a belly, and that is totally normal. But most likely, those little fat pockets still are not going to like reappear. You don't gain fat pockets when you have a baby. You're just touching and growing.
What is the most common area treated?
Stomach.
Stomach?
I feel like for women, it's stomach. It's like we have those little pouches, like we all have these little pouches that like appear, especially when you get 40. And those are probably the most common. Again, on the bra roll, I do a lot of really fit women that are just fit, and they just have those little tiny little pockets below the bra.
How long does it last? You might have answered this.
Like the treatment?
Yeah.
It's, it's one and done. So like once you get through your second treatment, obviously some people are like, oh, I'm going to do just one more just to kind of really target it. But it's not something you'll do again in like 3 or 4 years.
So someone said, so the treatment affects the fat on your body, not the skin. So if you have
Yes.
flabby skin, you will still have flabby skin, but not the fat.
It's so sad, but yes. I wish it did both. I wish I would come out with that.
Someone mentioned once you do this to get rid of the fat, could you do Morpheus 8 to tighten the skin?
Absolutely.
Yes, that's a great
It is a
combination.
great combination. Like I would tell people, do the Coolsculpting, then do the Morpheus. And in fact, I think we just had someone recently that did both. Like she did the Coolsculpting first, and now she's doing the Morpheus to her body. She's this cute little thing, and she just has some skin texture and some things we want to focus on her abdomen.
And both are on special. So if
Both are on special, which is a huge deal. If you're going to do Morpheus or if you're going to do Coolsculpting, today is definitely the day to do it.
and pairing them together would
Purchase
be
them together would be golden.
golden. Someone said, how long are you swollen for?
It just depends. I usually tell people it could be about 5 to 7 days. It's not typically any longer than that.
Okay.
And really it's more in the abdomen. When you do the bra rolls or you do the flanks, I don't feel like you see as much swelling at all. Inner thighs, like no swelling.
Is any numbing used?
Nope, no numbing.
No numbing used?
So
It just feels like, it just literally feels like if you feel like your ice cubes, when you get really cold on your skin, that's just what it feels like. It does not hurt. It's just kind of more of that feeling, and then it just
yeah, and if you want to show the camera, I was going to show that, like, you can actually see how much fat went into the little, I don't know if you can get it
I don't
off.
know if I'll be able to get over
Okay,
there.
well anyway, on the side, you can actually see how much got into the machine. It's amazing the square footage that we get on her belly. This one's kind of like the Big Mama. This is the one that we want to use, like cover the most area. That's what we always use for the abdomen. It's definitely my go-to, but some people need more sculpting, and so we have different hand pieces that we can use to do more of the sculpting.
Someone said, I've heard the massage after you take the machine off is painful. Can you talk about that?
It is painful. That's always the worst part. So we're taking off this cool device, and we're literally going to just massage the head. Actually, Ishla will be the massage person. So I think she's gentler than me. But what's basically it's just tons of blood flow right back to that area, and it's painful. But I usually tell people by the time I get it onto the second one, and the second one gets going, it's gone. It's not like this prolonged discomfort. It's quick. It's just at the moment you want to take Ishla's hands and throw them off you. But otherwise, it's good to go.
And do you want to run through really quickly all the areas? People asked, can you do it under your chin? Can you do it on your arms? Can you do the muffin top?
Submental is a great, great, great place. Let me see Ishla real quick. Take your mask off for a second. So submental, it's definitely more of that person. Like she's a great person for it. It's someone who's not to the point of needing a facelift. This is a great place to do. And sometimes what we'll do is we'll do one like this side and one on this side to kind of really get that tightening. Arms, thighs. We don't do the butt. Stomach, bra rolls. We have a little tiny one that we can kind of really pop almost anywhere. It's FDA cleared though for all of those areas.
And someone asked, how do they know if they have enough fat? They'll come in for a consultation.
Yeah, if you can squeeze it, you have enough fat.
And if you think you might be a candidate for Coolsculpting and you want to buy the special today, and you end up coming in and a nurse says, you know what, you're really not a great candidate for this, don't worry, you're not going to be stuck with a Coolsculpting treatment. We will make sure that it's you get your money back,
Yeah.
or we transfer it to something that you are a candidate for.
Yeah,
we'll
we
take
can
care of you.
transfer it to anything else, or it might be another area that you're like, you know what, maybe actually I want this area instead. So the Coolsculpting package, it's not for everybody, but if you go ahead and purchase it today and you come in for your consultation, we're like, yeah, this is not a good idea, we can definitely put it to Morpheus. Everyone's a Morpheus candidate. Or you can put it towards products, or like she said, we can give you your money back.
They're asking again how long the treatments take.
So this Big Mama, this one is for the abdomen. This one's 45 minutes. And then we're going to do her upper abdomen, that's going to be 35 minutes.
And then they need 2 treatments, right?
2 treatments, 30 days apart.
And that's the same for all areas of the
All
body?
areas, yep.
And does one area have better results than another?
It just depends on the person. Honestly, like I said, the rural area, the stomach, I mean, the biggest thing I hear about the stomach is how their clothes fit better. And it's like a quicker thing. Like all of a sudden they're like, I didn't lose any weight, but my pants are looser. I had one woman who I did all of her like abdomen flanks, and she had to get all of her clothes completely re-altered because her clothes were so big on her. But she weighed the same. So we really did target those fat pockets.
I think that's a big good point. Like, I think so many people think it's like a weight, can be weight. It's not weight loss at all. It's just that feathery fat that's light. It's not that heavy fat that you lose to make you lose pounds.
Yes.
So.
Let's see what else.
Make sure and comment below because we are giving away a Coolsculpting.
Ooh, yay.
How long to see results? You said it kind of depends.
It depends. Like, you're not going to walk out of here and say, like, oh my gosh, I see a difference. Because you will have, like, for abdomen, you'll have a little bit of swelling.
Would you recommend maybe wearing, like, Spanx or something after this? Or
You can, yeah. Some people prefer to wear the Spanx just to, like, kind of make everything just feel, like, tighter right after you leave. It's not necessary, but I feel like it helps.
Okay.
It does not tighten the skin. If you want something that might tighten the skin after you get rid of the fat, you said Morpheus 8 would
Morpheus 8 for the body, which we just got, and it's phenomenal.
And we'll be doing a live demo of that later as well, so you can learn more about that.
If they did do Morpheus, though, when they go online, what package do you think they should buy so they know?
For the body treatment,
Yes.
so I think, is the sale right now, let me tell you right now.
Because I know that that's probably going to be a question because Morpheus treatments are dependent on the area for size.
Yeah.
So just to eliminate.
It's about the
It's
size
the
of a
size
sheet
of a 10 by 10, which is like the size of, a little bigger than a piece of paper.
Right.
For abdomen or for belly,
so,
like for her, I would tell her to do the 3 treatments that's on sale.
yeah.
To cover all of her stomach. I mean, if you're tiny and you have like a small torso, then you could get away with just doing the 2. But I would say 3 for abdomen.
Alrighty. Well, guys, our time is coming to an end for Coolsculpting. Hopefully we answered some of your questions. If we didn't, we'll be posting these videos so you can watch them back at your own convenience. And if you have any other questions, please text us. We have a bunch of girls who are waiting to answer your questions. Text us at 314-991-5438.
Thank you for being our model.
Thank you, girls.
Thank you.
Bye, you